As you guys know, I'm a dentist, and that means we are trained to do all sorts of procedures, including root canals. Now, I know I talk a lot about different procedures and different things on my channel, but today I thought it would be interesting to actually show you a full procedure from the very beginning to the very end. So I saw this video pop up of a full root canal done from the very beginning to the very end. So I'm gonna react to it with you guys.
6 years ago, this patient came in and we let him know about this cavity that you can kind of see on the x-ray that was from then. And that you can see as a dark shadow underneath this filling. Then finally the decay made it down to this canal where the nerve of the tooth lies.
Wow, 6 years is a long time. And you can see from that initial shot that that cavity initially was still pretty big. So I'm surprised it took 6 years for that tooth to start hurting.
When that happens on a back tooth, and in this case it's a premolar, to save it, it needs a root canal and a crown, whether it's causing pain or not.
Yeah, so essentially what happens is that cavity probably doesn't hurt at first. And this is why a lot of times people neglect getting those initial things filled. Like if you have an initial cavity or something like that, it's not really close to the nerve and it probably doesn't hurt. And you probably just need a filling or something small to get it fixed. But if you keep ignoring that problem, that cavity is gonna keep getting bigger and get into the nerve. And once it's into the nerve, this can cause it to be really painful. And that's why you need a root canal like they're doing in this video.
So this here is the tooth again. And at this first appointment, we are going to do a root canal. To start, we put this rubber barrier or dam on the tooth. The rubber barrier is made to isolate the tooth so what is in your mouth doesn't get in the tooth while doing the root canal, and what is in your tooth doesn't get in your mouth.
Yeah, so essentially that rubber dam is to protect that tooth, so prevent any bacteria from getting into that nerve or anything as they're working on it. But also protects the patient's cheek and their tongue and their lips, because the dentist will probably put some irrigants or something like that inside of the canal, and you definitely don't want any of that getting in your mouth.
The next step is to make an opening in the tooth's upper portion or crown.
So right now he's just drilling it out.
It's opening because this gives us access to the canals we will see in just a moment. The access opening needs to be wide enough to gain access to every canal in the tooth and remove all the decay. If it's too wide, the tooth can become excessively weakened by this opening and fracture if the opening is too broad.
Yeah, so essentially you want to be as conservative as possible, but you still want to get out all the decay and the bad stuff inside of that tooth.
In this case, This tooth has so much decay, as you will see,
that's a lot of blood.
Opening is quite large for this tooth. However, sometimes you just can't avoid it. The tooth.
So interesting, what he's doing here is actually doing an injection right into the nerve. So when that blood starts coming up, that means you hit the pulp or the nerve inside of that tooth. And there's a lot of that red stuff or that blood just kind of gushing out of that tooth. That basically means that tooth is super inflamed or super infected. So this has probably been hurting this patient for a while. And sometimes the only way to get that nerve numb is to actually put that numbing shot directly inside of that tooth. Not gonna lie, that looks pretty painful, but luckily once that numbing is done, that pain completely goes away.
And the opening for this tooth is pretty big for this size of a tooth. Now, something that you might see here is this mushy consistency coming out. That mushiness or flakiness is decay when it comes out when using my slow speed hand piece drill. And that's actually kind of how you differentiate between decayed tooth and solid tooth. When it becomes powdery, the tooth is solid, healthy tooth.
Yes, essentially healthy tooth structure is really hard and like glossy and it's really smooth. But once you get all this decay, it's a really mushy consistency and you have to get all of that out of there.
So you can see we remove a lot of decay before we get to solid tooth. Once all the decay is removed, now we look for the canals through that access opening that we made into the chamber of the tooth. Those canals will present themselves as small holes in the tooth's floor.
So essentially what he's saying is you have these roots that are anchoring that tooth in the bone, but feeding that nerve are these little tiny canals. Now every tooth has a certain amount of canals. Usually in a premolar you have like 1 or 2, but sometimes you can have more. And then as you go further back in the mouth, like in your molars, you'll tend to have more canals.
We find the holes using a long pointy metal instrument called an endo explorer. When you find a canal, this tip will slightly stick in the canal, and when you try and pull it out...
So right now he's finding a canal using that endo explorer he's talking about.
All the canals can be quite challenging as these canals constrict and calcify and become smaller in time. So especially for older patients, these canals can become really small.
So essentially he's taking these files or these like rotary spinning files that go into that canal and start cleaning out that nerve.
If this blood supply in the center of the tooth dies, your body has no way to fight infection, so infection will easily get into these canals. So the reason we're doing a root canal is because infection got into them, and now to prevent it from coming back, we have to seal off the canals from future bacteria. To do do this, we start by removing the nerve and tissue in these canals with these long rotating mechanical files that you've seen.
Those are the files I was talking about.
Wraps around the file instead of getting torn into shreds. This nerve here, we won't be able to see it because it gets torn into shreds while I'm cleaning out the central canal and the nerve.
Yeah, so sometimes when you put your file into that canal, the whole nerve just kind of comes up with that file. It's kind of cool to see. But other times he was putting that irrigant. That irrigant is actually bleach that he's putting into the canals that kind of dissolves the nerve.
Sometimes we get lucky and the nerve comes out as a whole, and it's one of the joys, I guess, of being a dentist. Anyway,
the simple things give us joy as dentists, right?
We use a series of mechanical and manual files to unclog and shape each canal nicely so we can fill them. This part takes a lot of skill and there are a lot of challenges.
So essentially when you're going to those files, you have to go through a series of files and kind of shape each canal to the certain shape that you want. And yeah, he's right, it takes a long time and you have to be really careful when you do this.
Sometimes the instruments can break inside the canal, which could be fine, but it also could be...
And here he's using that bleach to kind of clean out that canal.
It's slow enough to avoid breaking files is best. In addition to those, these canals can become blocked and unclogging them can become quite a hassle. Another challenge, lastly, you must ensure you file these canals within 1 millimeter from the tip of the root, or the root can become reinfected.
Yeah, so it has to be very precise. You have to kind of measure each canal precisely, and luckily we have tools that kind of help measure that.
Irrigate it with sodium hypochlorite or bleach.
Yeah, so root canals are really, really precise, and that's why it takes a lot of training and practice to do them properly. Like you said, you want to try to be at least 1 millimeter short. Sometimes you want to try to go like 0.5 millimeter short of the tip of the root. Otherwise, you leave too much of that canal exposed that hasn't been cleaned away, and the whole tooth can get infected again. So there's something we actually use called an apex locator, which is literally something we attach to our file and that helps measure exactly where that canal is. And then we write down these measurements so we know every time we're drilling into the canal, we only have to go up to a certain measurement to make sure we're being consistent.
So those are the things that make a root canal challenging. Once we clean and shape the canal, we irrigate it with sodium hypochlorite or bleach. If you shape the canal sufficiently, this will kill all.
This is the bleach that I was talking about before.
For people with significant infections, this can even make a burning sensation. So after we filed and cleaned all of the bacteria out of the canals, we are then ready to seal off the tooth. To seal off the canals, we use these long rubber-like cones made of gutta percha, which is a natural substance.
So that gutta percha is that orange thing that you were seeing him put in that canal. So once you get up to a certain size file, you have an exact same size gutta percha that you can put in the canal afterwards. And that's basically to seal everything up. It's kind of like this Play-Doh or rubbery texture, and it kind of forms to that canal to seal everything off.
So they should fit in the canals perfectly, just like the files you used. Before we finish, we take a quick x-ray with the cones in the tooth to confirm that they will fill the canal just how we expect them to.
So you take an x-ray just to make sure everything looks good.
Irrigate with bleach one more time to make sure the canals are clean, and then we take paper cones which dry the bleach from those canals.
So that irrigating that he's doing is the most important part of root canals. If you do not irrigate enough, then that tooth can get reinfected. And now he's just drying it out with those paper points, which are the same size as that gutta percha. Once everything is dry, he's gonna finish it up.
And then after drying them, we mix sealer and coat the canals.
That sealer he's talking about is something that basically combines with that gutta percha to really seal off that canal so no bacteria can get inside of it. Now for him, he actually coated that gutta percha and then put that sealer in. For me, what I like to do is an injectable sealer, so it's a sealer that goes like into the canal, and it's just this liquid that goes in there, and then you put the gutta percha in after, and it basically does the same thing.
And put the gutta percha cones back into place, and that's what seals off these canals. After all that, we melt off the excess.
So now he's gonna take a really hot instrument and just sear off that gutta percha.
And that's pretty much the root canal portion. When the numbness wears off, you can expect some soreness that will likely differ from any soreness that you may have had before the root canal was done. And that soreness is due to inflammation and will probably go away in a few days. And ibuprofen normally works best in this case because it helps with the pain and the inflammation.
It's really true that ibuprofen works so well because your tooth at this point is really inflamed, and the ibuprofen is really good at fighting inflammation. And studies even show that's working better than like codeine or some of the other opioids out there.
You need to be careful chewing on this tooth until the final crown is made, as it is weak and can break until you get that crown on it.
So that point was really important, because the reason you need a crown after a root canal, especially on the back teeth, is because those teeth do so much chewing. But when you do a root canal, you're cutting off the nerve and the blood supply, so that tooth gets more brittle. So you want to be really careful until you get that crown to basically protect the tooth.
That leads us to our next appointment, where we will start the crown and put a post in the tooth to give more strength to this upper portion.
And there he put a cotton pellet. That cotton pellet is basically what's blocking the nerve and where that gutta percha was to kind of protect it. And then he's putting a temporary filling. He's probably going to bring the patient back and then do the crown at that visit.
Here we are at the next appointment, usually between 2 and 14 days later.
So the numbing he was doing is called an IAN block, or an inferior alveolar nerve block. That's basically targeting this nerve that runs across your whole lower jaw. Now technically for this case, he might not need to do that because one, the tooth already had the root canal, so the tooth doesn't even feel anything, but it might be a good idea to get the gums numb. But you can probably just do some like local numbing just to kind of get the gums numb in the area so you don't have to get the whole jaw super numb.
We start by removing the temporary filling from the tooth until we expose the beginning of the filling.
So now he's probably going to do a permanent filling that goes underneath the crown.
This tooth, we need to anchor it to the stronger root portion of the tooth. Otherwise, the crown would likely break months down the road, like I already mentioned. So we start by giving the tooth a post.
Oh, so he's doing a post in the tooth.
You can see on this screen the top of the root canals. And I'm going to go into the canal and remove a lot of that filled canal.
So he basically drilled into where he did that root canal to make room for this like post that goes inside of the canal and kind of hangs out there.
What we're doing here is I'm taking a fiber post that we will use to fill the...
So that post is made out of fiber.
And I'm just kind of sizing it to see what size I want in the canal and upper portion of the tooth. I use fiber posts because the older metal posts commonly fracture the root.
Yeah, we don't use metal posts anymore.
Fiber posts are much more kind to the tooth. So this post fits nice now, and we're going to bond it into place.
So typically you do a post when you don't have much tooth structure remaining. So like if a bunch of that tooth is missing, and kind of in this case there's a lot of tooth structure missing, you can see, that post is just extra anchorage for everything to hold on to and prevent that tooth from breaking.
To get a strong bond, we etch the tooth surface, then we place the bond in the tooth with this brush, and we kind of scrub it into place.
So that's typically how a normal filling is done. So he puts that etchant, which is something to clean the tooth, and then he puts bond on the tooth, and that's basically like a glue, and that glue is what glues that normal composite. Now after you bond, you have to like light it to kind of harden it, and then when you put your filling material, you have to harden it again. Now in this case, since it's a filling that's going underneath the crown, he's probably going to use a different filling material, but it's essentially the same concept.
Then we use a light to set that bond, as well as a...
That's where he's putting the light.
Set the bond down in the canal where the light can't reach. This next material we use is called core paste. It fills up the bulk of the tooth and also bonds the posts that we are going to put in now. So you see this post fits into the canal.
So this is called core paste. So it's basically like a big bulk filling material that goes underneath the crown, but it's not something you would use for a regular filling.
Of the tooth. We then just used my little dental explorer to try and open any air bubbles that might have formed while we were filling it up. We do find one, and maybe you can see here where I put the explorer in, it kind of opens up one of those air bubbles. Once that air bubble is opened up, we fill that.
You can see the amount of work that goes into just saving one tooth. This is that person's second appointment.
Set the post and bulk filling into place in just a few seconds. The core paste will also just kind of set on its own if the light doesn't do all of it. But the light is good to kind of get things going because we have a lot of work to do during this appointment. Now
he's going to prep it for the crown.
Portion of the tooth firmly anchored to a post to the lower root portion of the tooth. The core of the tooth is now strong, so the next step is to drill 1.5 millimeters to 2.
Yeah, so essentially when you do a crown, you have to kind of shrink that tooth to a smaller version of itself. And the reason you do that is because you want to have enough room for the thickness of the crown. Otherwise the crown will be too thin and it can break. So that's why you have to shave down like 1 to 2 millimeters all the way 360 degrees around the tooth.
We file the tooth down because eventually the crown is going to fill in this space we are drilling out.
So you can see that tooth's getting more yellow where he's drilling, and that's because you're getting rid of that enamel, which is the outer layer of the tooth. Typically you try to protect and preserve that enamel, but in this case, you have to get rid of it so you can get the crown.
Now, I am not aimlessly drilling. If you drill too much tooth structure away, the crown can become loose from time to time.
Yeah, so you have to be careful.
Due to the lack of retention from the walls of the stump left behind being too steep. But then again, if you drill too little of the crown away, it won't be thick enough.
Exactly, so you have to drill just enough.
Time as you chew and bite on the crown.
So I kind of fast forwarded a bit to kind of save you some of all that nastiness that he was showing.
This gel here that I'm using is called Viscostat, and it helps to stop bleeding when it is scrubbed onto bleeding gum.
So there he's putting Viscostat. Viscostat is something that tastes terrible, but it's something to stop any of the bleeding.
This Viscostat tastes terrible, so we
Like I said,
wash it away. And then once the gums are done bleeding, the patient bites down to make sure we have enough space between the...
So now he's just checking to make sure that he reduced enough of the tooth structure.
Opposing teeth it bites up against. So that's what we're doing right here, is we're taking an impression of the tooth.
So now he's taking an impression. So once the drilling's all done, you can either do a scan, which is like a digital camera that kind of takes pictures of the tooth, or you can do a traditional impression. Nowadays, people are doing more scans because technology is advancing, but you can still do a regular impression. And you'll use this impression to basically send to a lab, and the lab will look at that impression or look at that scan that you did and design a crown specifically for that tooth.
I like to do this in 2 steps. First, we take an impression with a quick setting hard material called Blue Bite. Then we remove the impression when it is hard, and then second, we add a more detailed impression material layer, and we snap that back into place in the mouth. This method pushes the material below the gum level to get an extremely accurate impression of the margin below the gum level. And then eventually we take that impression out of the mouth, and if you know what you're looking at, you can see here that it has an accurate impression of the margin.
So this part is super important. It is crucial because you got to capture the margins of where that preparation is. Because when you drill that crown, the edges or the floor of that preparation are where the margins are. So you want that crown to sit perfectly over that tooth that you prepped.
Next, we take the shade of the tooth that we also took before the appointment.
Picking a shade, make sure the crown looks similar color to the other teeth.
Shade, and we send it to the lab. And the lab will take this and make a stone model of the teeth and take that shade, and they'll build a crown on.
I don't know what he's doing here.
This will take the lab a few weeks, and then we'll get that crown back. In the meantime, we have to make a temporary crown so that the patient doesn't go with this stump of a tooth exposed.
I don't know what he's doing.
We use another impression we took before we drilled the tooth down as a template. The temporary crown material fills only the impression template of the original.
Oh, I see what he did. So basically when you get that crown prepared, it takes time for the lab to make that final crown. So we're not just gonna send you home with a stump of a tooth. So what he did was he actually took an impression before he even started, a different impression of that tooth, and is using that old impression to make a temporary crown. And that filling material that he was putting around the gums before was because that tooth had a big hole in it, if you remember from that big cavity. And that filling material was basically to fill that hole, and it kind of combined with this temporary crown material because a lot of different dental materials can be mixed together. So that way when you put the impression back in, it all combined to become one big tooth, not a tooth with a big hole in it. Now there are other ways to do it. What I like to do is before I even take that impression, I just kind of fill that hole with some wax or something to kind of fill it up that way. It essentially does the same thing, and it ends up turning into one big whole tooth when you make that temporary crown. Now I'm assuming what he's gonna do next is start trimming the margins and everything and kind of clean it up to make that temporary crown look good.
In that negative space where we drilled away the original tooth. When we snap this impression back into place, the material will fill the void between what the previous tooth was and the stump that is now left behind. So this temporary crown will actually be fashioned after the original tooth. Once we remove the impression, you can see there's a lot of excess temporary material that needs to be moved and trimmed away so that we can make this look like an acceptable tooth for those weeks that the patient will be waiting for their final crown. So we take a few minutes to trim it, smooth it out, and make sure it feels even when biting. Then we dry the tooth and use temporary cement to secure the temporary crown into place.
So that blue mark on that tooth is basically where that tooth is hitting. So when you bite on this piece of paper, you start to see these blue marks where you hit. And on that temporary crown, you want to make sure it's really, really light because for one, the tooth had a root canal and it doesn't have its permanent crown yet. So you want to be careful how hard you're biting on it. But also that temporary crown is easier to break. It's a lot more flimsy. So if you bite into something hard on it, that temporary crown could break off.
Until the next
You see the margins actually look a lot better now that he trimmed it.
The day, we then remove the excess adhesive, which looks pretty good after we removed it, especially.
So now we put temporary cement on it. That cement is meant to come off. It's not meant to stay on for too long. So while you want to avoid really hard foods with your temporary crown, you also want to avoid really sticky foods because it can pull that crown off because it's meant to come off when you get the permanent crown.
It will get the job done until the final crown appointment. So let's now fast forward to that next appointment.
Now this is the patient's third visit, the third time just to save this one tooth, but this is the best one because it's the easiest one and now he's gonna get that permanent crown.
So here we are at the final appointment where we will try in the final crown. So we first have to remove that temporary crown and then clean off all the temporary cement.
One thing I want to point out, that color matching looks really good. You can see, you can't even tell when that crown is in which one is a crown and which one is his natural teeth.
And here we are slipping on the final crown, and we're checking for 5 criteria for an acceptable crown before we cement it permanently into place. We will also make necessary adjustments so the crown will pass all those points. First, we check how well this crown contacts with the adjacent teeth.
Yeah, so these things are really important. The first thing you always check is how tight that crown is to the neighboring teeth, because if it's too tight, that crown will not go down all the way. But if it's too loose, now you're gonna get a bunch of food stuck in between the teeth because you want a nice snug contact.
If floss snaps nicely through the
And you check that contact by flossing to see how tight it is.
chewing, wrap between the teeth when chewing. If it's too tight, the crown won't sit all the way down, so we make sure the floss snaps nicely through. Second, we check the internal of the crown. If something is high or off internally, the crown will kind of rock, and if you don't fix it, the crown will loosen in time as you chew it, and you'll have to keep cementing the tooth on from time to time. Third, we check the margin where the tooth and crown meet. It needs to be flush and not catch my Explorer when I'm checking it.
This part's also super important. Remember how I talked about when you take that impression or do that scan, you need to clearly see those margins because the lab is using those margins on that impression to design that crown. So everything here has to be perfect because if you have one little gap or one little hole in that margin again is where that crown meets the tooth. If you have one little hole, then you can get all these bacteria, then you can get a cavity or an infection underneath it, and then all that time and money spent on this tooth is gonna go to waste.
It needs to be flush and not catch my Explorer when I'm checking it. If this is open, the lab will need to remake the crown because the margin is the weak point in the crown. Once again, if it's open, it will catch food and decay will start here. Fourth, we check the bite. The bite is very commonly off and needs to be adjusted.
The bite is also super important because even if the bite is a little bit off, the patient can have a lot of pain. Like you could be biting on it. You might wonder, like, I had the root canal, why is my tooth hurting so much? Well, if you're biting just a little bit too hard on it, then you're constantly gonna be hitting that tooth and cause a lot of inflammation, and that can be really painful. So you just gotta make sure the bite is good, and you gotta take that extra time to make sure everything looks good.
You want to make sure this tooth feels like it bites evenly. If the bite feels like it hits the crown before the other natural teeth, then that crown tooth can become sore over time and even cause jaw problems. Fifth, we check the cosmetics. If the patient is happy with the way it looks and that the crown meets the other 4 criteria, then we're on to cementing the crown. So to cement the crown, we dry the tooth and then we put permanent cement on the interior or internal of the final crown and have the patient.
So I think that crown looks great. And just like he did with the temporary crown, with the temporary cement, now he's gonna use a permanent cement on this, make sure that tooth is dry, and then glue that crown on.
And you will see that a bunch of excess cement gets expressed out of the crown. We remove the excess cement with an Explorer and floss and other materials.
You also notice that that patient's gums in the area are bleeding a lot and they're super inflamed. That will heal on its own now that he has a permanent crown, as long as he keeps that area clean. So it's really important now that he's able to floss, they did all that checking to do that flossing and brushing at home. So I hope you guys enjoyed that video and learned a little something about getting a root canal and then eventually getting a crown on a tooth and what that all entails. And hopefully you can also appreciate your dentist and see how much work and technical skills go into saving just one tooth. And this is just a routine thing that we do every single day. So anyways, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. I talk a lot about mouth breathing and why it's so much better to breathe in and out of your nose. Now, with that being said, what actually happens to your body if you breathe through your mouth every single night? This may not seem like a big deal, or it might seem completely normal, but a lot of people, when they sleep, their mouths are wide open. And that means that instead of breathing through their nose,